One of our own frontline heroes took the challenge to battle the pandemic at an epicenter right at the beginning of the outbreak. Today, local News 8's Juliana Colina shows us his story of compassion in New York.
Kept having the feeling that I needed to be there. I kept seeing commercials and things of them asking for help.
For 6 weeks, Aaron Craythorne left his daily duties at Mountain View Hospital in Idaho Falls. He went to work 14-hour shifts at the Lincoln Medical Center in New York, treating COVID-19 patients.
It was literally like walking into a war zone. It was an organized chaos, we'll say.
Lincoln Medical Center is one of 11 public hospitals in New York, which were all overwhelmed with the virus. Craythorne tells us there were 5 floors dedicated to COVID-19 patients and that the lack of medical equipment forced the staff to make difficult decisions.
Who's going to get the good ventilator versus who's going to get this other one? And it would come down to who's more likely to survive.
Craythorne says the virus is something that needs to be taken care of quickly and with the right equipment, but with an overwhelmed healthcare system, that wasn't always possible.
A lot of the people that were in the hospital, especially the ones that went on the ventilators, about 85% of them died.
Our living space in East Idaho isn't as tight as those in New York. So Craythorne says as long as we follow the guidelines set by the CDC and local governments, the virus should stay manageable for our healthcare system. Craythorne came back from New York with an advanced knowledge on how to best help those who do contract the virus.
The way we treated COVID over there, it's not like any other virus that you're used to treating.
Reporting in Idaho Falls, Juliana Colina.
And Craythorne tells us there were about 150 ventilators running at one time. It made the rooms incredibly hot, especially when they were under so much personal protection equipment.